Arthritis Unpacked is a patient education resource developed and owned by Janssen Australia. The content is created by Dr. Paul Bird with the support of Janssen. The information provided is for educational purposes and does not replace the advice from your healthcare professional. Always refer to your healthcare professional about current treatments, possible side effects, and other considerations. Paul Bird is an experienced rheumatologist and researcher dedicated to the expert management of patients with all forms of arthritis and rheumatic disease. As well as caring for patients in his clinical practice, he continues to undertake arthritis research with fellow Australian rheumatologists and international colleagues, ensuring he is up to date with the most recent medical advances.
Welcome to the third episode of Arthritis Unpacked, a podcast series designed to help you understand your arthritis better and help you get the best out of your treatment. Join me, Dr. Paul Bird, an arthritis specialist, which is also known as a rheumatologist, as together we unpack your arthritis baggage, helping you navigate the maze of arthritis terms and treatments. Arthritis without the jargon, arthritis made simple, Arthritis Unpacked. Let's continue this journey on understanding psoriatic arthritis, one of the common forms of inflammatory arthritis and part of that larger group of spondyloarthropathies. In the last podcast, we talked about the causes of psoriatic arthritis, the symptoms, and what might happen when you first see a rheumatologist. Investigations are an important part of making the diagnosis correctly. By doing investigations, I can accurately define what type of arthritis you have and then map out a plan of treatment for you. These investigations include laboratory tests such as bloods and often imaging like X-ray, ultrasound or MRI. Let's first look at the blood tests, which are also known as labs, that might get done, unpacking these labs so they make sense. Let me take you on a quick tour of the blood tests that we do. Remember that when I'm doing tests or reviewing the tests, I use some blood tests to help me make the diagnosis, and some blood tests I'll do along the way because they help me to work out how you're responding to therapy. That's why some tests like the gene test HLA-B27 are only done once, but other common tests like the ESR and CRP are done more regularly. Let's walk through each test one by one. HLA-B27. This is a test for a gene, more commonly found in subjects with psoriatic arthritis. HLA-B27 is associated with a larger group of autoimmune diseases called the spondyloarthropathies, and these include psoriatic arthritis. Remember, this test alone does not mean that you have psoriatic arthritis, because around 10% of the general population have the gene. But placing this piece of the puzzle with other clinical and laboratory features helps the rheumatologist make the diagnosis. This test is a diagnostic test, and it won't change. Therefore, we only need to do it once. It helps establish the diagnosis. Erythrocyte sedimentation rate, or ESR abbreviated. The ESR test helps determine the degree of inflammation in your body, how active the psoriatic arthritis is now. Erythrocyte sedimentation rate, ESR or SED rate, measures levels of inflammation in the body. When the body is inflamed, it starts producing proteins that make red blood cells, or the erythrocytes, clump together. A doctor will put a blood sample in a tube, then measure how far the red blood cells sink to the bottom in an hour. They'll drop faster when inflammation makes them form dense clumps, so a high SED rate signals high inflammation. This is a really good test to tell me how you're responding to therapy. It also tells me how much inflammation is present at the start when we make the diagnosis. We use this combined with another test called C-reactive protein, or CRP. This is another marker in your bloodstream which tells us how well you're responding to therapy and how much inflammation you have going on. Think of these tests as members of the same family. The ESR and CRP can both tell us different things about where your inflammation is, and so we use them both when we are monitoring how you're going. It's important to note that not only psoriatic arthritis can elevate the ESR and CRP scores. Sometimes, if you have a bad throat infection, for example, the ESR and CRP will rise as the body's response to infection motors along. Often as a rheumatologist, part of my job is trying to sort out whether the ESR and CRP scores are up because the psoriatic arthritis is active or because there might be something else going on. Remember that many people with psoriatic arthritis do not have elevation of the ESR and CRP even though their joints are inflamed. We don't know exactly why this is, but be reassured that we don't withhold treatment from people just because their ESR and CRP aren't raised. If the rheumatologist can see the inflammation, then he or she will treat it. And I'll use other markers to determine how you respond to treatment other than the ESR and CRP. Let's talk about other blood tests or labs. FBC. FBC or CBC is full blood count or complete blood count. This checks to see if there's any anemia or abnormality in the white cell counts. EUC. EUC is a check of kidney function to make sure that it is normal. LFT. LFT stands for liver function tests, a standard baseline test done in most patients who present to medical practitioners. We do these background tests as a general check, not because psoriatic arthritis specifically affects the blood or the kidneys or the liver. Now let's switch gears and talk about imaging, which are X-rays, CT, MRI and ultrasound. You may have had these done and wondered why. So let's unpack that now. X-ray, ultrasound and magnetic resonance imaging or MRI. Part of today's modern assessment of the joints in rheumatology may involve ultrasound or an MRI. Standard X-rays are still used, and most people will come with X-rays of their hands or feet when they first visit me. We used to use these X-rays a lot, but we don't use them so much these days because modern therapy means that most people won't get the kind of joint damage that we used to see on X-rays. And although the X-rays give us some clues to the diagnosis, unfortunately they are minimally helpful in making the diagnosis of psoriatic arthritis in the early stages. MRI or magnetic resonance imaging uses magnets to make wonderful images of the joints. I really like the way MRI produces a 3D picture that can show what's happening around the joint and inside the joint. For those things I really want to see: bones, cartilage, synovium, fluid, ligaments and muscles. Ultrasound uses sound wave technology to look into the joint and see how much inflammation there is, and can be used to see how well you're doing on therapy as the inflammation resolves. Now each type of imaging gives me different information. Not everyone needs all of these tests, as most diagnoses can be made without them. But sometimes I'll need extra information to help me diagnose or to check how treatment is going. That concludes our short tour of the tests, the tools that we use as a rheumatologist to help us make a diagnosis and to monitor how you're going on therapy. The next Arthritis Unpacked episode deals with treatment of psoriatic arthritis. Treatment can be a big, scary suitcase, but it needn't be. So let's unpack it together. Once you see each part and understand what it's for, it's not so frightening. I'm Professor Paul Bird, and this is a podcast all about arthritis. Without the jargon, arthritis made simple. Arthritis Unpacked.